All right, welcome back to the Elias Makos Show. Now, a spokesperson for the private healthcare staffing industry has a warning. Quebecers will feel the consequences of ending reliance on private agencies. Now, that's a stated goal of the Quebec government. They want private agencies out of healthcare staffing. But the industry says that the public system cannot meet all of its needs on its own. Let's go to Patrice Lapointe, president of the Private Healthcare Staffing Association, also the owner and CEO of Progressifs, a staffing agency. Patrice, welcome to the program.
Thank you. Good morning, Mr. Makos.
So make the case on if the Quebec government goes down the path and they try and get every staffing agency out of the healthcare network, what do you think the consequences will be?
Well, as an industry, of course, it has been a shock during the past year for us, but most businesses have already moved on to other markets. So the real tragedy has always been and will always be that it's the patients, the employees, and the general population that are suffering from it. We've always said that there was nothing more easier for the government than to stop using our agencies. They just have to stop calling us. But the problem is on the next day when they have to replace what we bring to the table in the healthcare sector. And the consequence, we've been seeing them for the past year, and they are only going to get worse. We see overtime and forced overtime that are on the rise right now with all the human and cost and the financial cost that goes with it. We see a government that seems to be normalizing the breakdown of services all across the province. We have many examples in the north, of course, but more recently we've seen the Notre Dame Hospital, the birth unit. It cost us over 20 million collectively to build, and it has been it has been working for maybe a bit more than 6 months, and now it's closing down permanently. It's for a lack of healthcare workers such as nurses and nurses assistants. So the worst of it will be, sadly, as always, on the shoulders of the patients that need the healthcare services that they can get, because the healthcare services they need the staffing agencies.
Yeah. And let me tell you, boy, do you ever have an argument, right? When you tell us about the situation at Notre Dame Hospital, right? Where a maternity unit is closed, right? Because of these staffing shortages. That makes a great, compelling case. But let me just throw one thing at you and why at times I've been partial to the government's position on this. And it's been because, and this is the thought that staffing agencies, they act as a middleman in healthcare and they take a big old cut, and that we're trying to cut costs, and that if you can take out that middleman, you'll have more money for care. What do you say to that?
Yeah, well, that's a common misconception. Our industry has been around for a bit more than 5 decades now, and we've been playing an essential role in supporting the public healthcare sector for all those years. So there's a case. We have the economical studies to back it up. All of those years, we've been a presence that has made even economical sense, because what we bring to the table is the ability to act fast where the need is, and to roll back out once the need is not there anymore. It's like we are the firefighters of the healthcare system, because as it's well known, it's very bureaucratic and very heavy on regulation. So they're not able to act with the same agility as us. So let's say the government made a case during the pandemic that there was a problem. And, we were the first ones to come forward and said, you're right, there's been a loss of control, and not on the part of the industry, but the healthcare sector lost control. So there needs to be strong solutions. But it should be almost academical at this point that you don't draw rules from an historic crisis. You draw rules from what's been happening for decades. And now you see that there's a problem that we've openly admitted on every and each of our public appearances. And you say from there, how can we set things back up, how they should be and how they have been before, and build upon this. And we have proposed many solutions. But when you look at the big picture, our businesses have provided strong economies throughout the years. Because when somebody is in overtime or forced overtime, there's a human cost to this. And there's a financial cost that is way heavier on the public finances than a staffing agency if it's used in the right circumstances. And this has been our argument from the start.
We're with Patrice Lapointe, represents the private healthcare staffing industry in the province. So, Patrice, you're making the case here that, yes, there is a premium, but it's worth it for the flexibility. What you and your peers in the private agencies, the flexibility you provide the system actually benefits the system long term. But you did mention that you're willing to be part of some solutions here. So tell me about the problems that you do see and how you say you can help the government in its goals.
Well, first of all, from what we've been seeing, when you look at the long-term impact, a lot of times are even now when you replace regular staff in overtime with our staff, you're realizing economies on a financial standpoint. And after that, you have all the indirect economies. We've been hearing Santé Quebec in the past weeks or months saying that, they're still trying to roll back pandemic over structures, staffing structures that they had. So they said, we're not cutting staff here. We're just going back to what we were before the pandemic. We're 3 years after the pandemic, and it's still not done. It would have taken 3 hours or maybe 3 days for a staffing agency to roll back out. What are those indirect costs for the population? They're astronomical, and they don't exist when you use a staffing agency. So we've always been providing a solution. Like I said, we're the firefighters of the system. When there's a crisis, such as the pandemic, but there are many crises during a year, they call upon us. We act fast. We're there when the patients need us the most. And we provide something that can be rolled back very fast after that.
But have you ever taken advantage? Listen, I'm not saying this as a negative. Any person, I think, in a similar situation, especially a business person, if you see a government and their backs are up against the wall, you might want to take advantage of the situation. And does any of the blame go on your industry, who at times may have taken advantage of a government that was out of options to jack up rates and charge more than necessary?
This is a very important question, and I thank you for saying it, because what happened is our industry typically had between 20 and 30 businesses, and we had long-term contracts of 3 to 5 years with fixed rates. So when the pandemic came, all of those businesses that have been in the healthcare sector, the public healthcare sector for a long time, we didn't even have that option. But there was such a loss of control on the public part of things. We had the army in some places because they completely lost control. They started signing contracts with everybody and anybody. And a lot of those people, they were in a position where they could abuse the situation. And this had a tremendous impact on everything, on our whole industry, because from overnight, some businesses with no qualification were billing at 3-4 times the normal rate. So of course, it's having an impact on everybody afterwards. But we were the first to put our hand up and say to the government, this has to stop. We need to take back control because you're hurting everybody. Your partners that have been with you for many years included, and it's the population that will pay the price for it, and many employees that were in vulnerable positions also, because there's been a lot of problems on that front too. So for us, it's not businesses that saw an opportunity and said, we're going to jack up our prices and make a lot of money on the short term. It's about a government that lost the control in an historical setting, so we're not blaming them for that. But like I said before, if you're a sound manager, and the first thing you look at is you don't draw rules from an historical crisis that is once over 100 years in the making. So this is the problem. So like I say, we need to talk with them. We are ready to implement strict regulation. This is what we've been proposing for the last 2 years now. But they have to recognize that what we do, they are not able to do it. We saw it with the Équipe Volante Quebec. It was, it never went off the ground. It was a catastrophe. And we're seeing it over and over as more and more services become unavailable to the population.
But Patrice, let me tell you something. You are a real effective spokesperson for your cause. Really appreciated talking to you.
Thank you very much, Mr. Makos. Thank you for the time.
That's Patrice Lapointe. He's owner and CEO of Progressifs, a staffing agency in the province.